resources that the Long Beach Family Preservation Program uses. So I'm Tricia, this is Brittanie, and this is Donna. We are doing the Long Beach Preservation Family Program, and the mission of the program is Family Preservation Program is a partnership for families. It is designed to strengthen and preserve families whose children are at risk of placement in and out of home care, strategically, professionally, and respectfully guide families through services. The primary client, there really isn't a specific primary client. All family members are considered the client, which can be challenging because some families have several children. Probation youth are also referred to the agency, in which case the entire family participates in the treatment. The demographics, mostly made up of African American and Latino. More than 80% of the clients are low income. 1/3 of the clients are two-parent households with multiple parents. 50% of the probation youth are both male and female. And then the 2007 statistics were 80% male and 20% female. And then the services that they provide, in-home outreach counseling. It's a weekly 1-hour home visit for which all family members must be present. The sessions provide comprehensive assessment, case management, linkages to services, counseling, monitoring of child safety and participation in services, and crisis intervention. The MCPC meetings, multidisciplinary case planning committee meetings, which take place every 60 to 75 days. The meetings are attended by the family, the referring DCFS children's social worker or probation officer, and a family preservation program staff. The committee works together to develop a service plan and monitor progress in the program. Based on the individual's needs, participants may also receive teaching and demonstration services. It's a home-based life skills training on issues including home safety, cleaning, budgeting, and meal preparation. Substitute adult role model services, which is a mentoring service for youth aimed at fostering positive behavior and academic improvement. Also parent training. There's a weekly group parenting class and support groups. Mental health services, individual and or family counseling services also. There's also youth groups, enrichment groups from ages 8 to 12 and 13 to 17, and anger management group for teens. The family support program provides activities designed to teach families how to spend quality time together. These activities include recreation and holiday gatherings. Linkages to other community services, including job training, employment services, alcohol and drug treatment, developmental services, housing assistance, and child care. Additional services are mom and daughter and father-son, 6-week strengthening family workshops, and support for grandparents. By promoting safe decisions making and parent/child bonding focused specifically on tweens, this aids in parents having difficulty during the in-between stages. And at the end of the day, the program is a partnership for the family. For reducing child abuse and neglect, there's an in-home outreach is the most efficient way to help preserve the family because the setting facilitates the client's cooperation due to the fact that they feel comfortable in their own home and are more willing to trust the case manager. In the 1980s and early 1990s, research was done by the federal government and data was collected showing that in-home outreach program is successful. And then in 1994, funds were given to a nursing program to further the research. DCFS and LA County, along with the federal and state funding, are the proof that this program works. And the Long Beach Family Preservation Program has received 66 grants in LA County for family preservation, and the first 5 is also funneling money into the program. Some of the mental health issues are many clients are recently diagnosed and are violent and are angry teens. Common mental health issues and needs are postpartum depression, bipolar disorder, schizophrenia, drug abuse, generalization, physical and emotional abuse. The Long Beach Family Preservation Program doesn't specifically treat for mental health issues. Instead, they refer the client to another mental health provider for specific treatments, like the Jewish Center, which specializes in domestic violence and mental health.
The focus of the agency, they technically don't do a lot of investigation or assessment of risk. It's usually the DCFS and probation officers. They do all the investigation and assessment. of parental capacity along with the strengths and needs of the family. The agency mainly focuses on directly collaborating with the family to develop a service plan while guiding respectfully and strategically and monitoring behavioral changes. Strengths and weaknesses. The strengths would be the resilience because of past experiences, the sort of I'm still standing mentality, their ability of day-to-day survival, and their resourcefulness. Rosie, who we interviewed, said she doesn't really like to call them weaknesses, but it's more of that they have a lack of support system. There's no cheerleader in their life to back them up. And another weakness, they don't really believe in themselves, so it's hard for them to make the change. And also, abuse is difficult to break because of the generational abuse. Measuring success. She said qualitative is better than quantitative, so how they change and not how many. LA County collects data and breaks down success by rating each individual case manager and program. The goal of the agency is to keep parents and children together, so if this happens, then success. An example is they have family nights where they try to help the parents bond with the children. So they had one night where they would bring in all these old war games like Sorry and Monopoly, and they had this father of 3 girls. At first he couldn't really communicate with them really well, and he was having trouble, bonding with them. And over a period of time they came back, and Rosie said she saw him bonding so well with them and just really connected with his daughters, and she said that was really rewarding for her to see that success. Collaboration. Jewish Center, these are all the different people they collaborate with and work with, specializes in domestic violence and mental health services. For the Child specializes in sexual abuse. Children's Institution, which focuses on fathers. Guidance Center specializes in mental health services. Community quarterly meetings. Basically the program is mandated to have communication and collaboration in order to form a network made up of multiple agencies. All the agencies work together, meet monthly, and have healthy working relationships with each other. There's no territorial thing where oh, this is my client, this is my client, because they know each of them have their own specialties. The program only takes clients referred to them by the DCFS and probation officers, so there's no soft referral, you can't just walk in. This program is the largest and most funded program. Qualifications, they either have to have their MSW or their MD in a related field, or a bachelor in social work with a minimum of 2 years experience with at-risk families, and interning does not count. Applicants are screened and sent to the funder, and all potential employees must have a background check. And Rosie was also saying qualities within their personality should be a lifelong learner, open-minded, to be genuine. You must have a flexible schedule because things are always changing. You have to be a creative thinker, passionate for people, and do the right thing even though it's painful and unpopular. She was telling us, a lot of times you're not going to be popular, people are going to hate you and be mad at you, but that's your job. Yeah.
So as far as staff training, there aren't any funds available for them, excuse me, to pay for outside training. So when employees choose to do that, they have to pay for the trainings themselves, but they are paid their daily rate. The center itself does offer monthly trainings for the case managers, and that covers recent trends and different topics. And then they also have bi-monthly agency meetings where they bring in different people. Last month's training, she said, was held by a public health nurse. And so they also have training with the case managers that's administered by the clinical supervisors, and that helps them develop the life plans that are necessary to help the clients get through their difficult situations. And then as far as staff turnover, she said, so there's 15 people there, and 4 to 5 of them have worked there for about 5 years. And then there's a few more that have been there for 3 years. She said every year they hire approximately 6 people, but they lose 3. And she said the people that they do lose, they're usually gone within the first 2 months. And she just sees that it, with the 3 that go, it's usually due to it not being a good fit, and they're just overwhelmed with what they're seeing out in the field. Some staff members have reported, that they've had their cars keyed. There haven't been any reports of physical abuse. She said that safety is a big concern, and the staff is trained to follow their gut. They carry an average of 13 cases each, and they ideally are spending 3 hours a week on each case. And the case managers sit down with clinical supervisors on a weekly basis to provide them with help with the families, but also to help them work through their own issues, such as like transference, county transference. And the center does provide opportunities for the case managers to work through their own issues, like I just said twice. Okay. And then as far as adapting for minority needs, she said that their staff is, most of them are bilingual, and they are from diverse ethical backgrounds. They have African Americans, Latinos, Asians, and Caucasians working for them. They encourage the staff members to be aware of their own specialties and their limitations, and so they go through cultural competency trainings, but they're also reminded to utilize the skills and the strengths of their colleagues. So if a Caucasian worker is working with an African American family, they're encouraged to go to their African American colleagues and ask questions and get some help to better understand the family system in that culture. Confidentiality is an ongoing matter. Staff are prohibited from contacting clients through emails. When they do home visits, they are not allowed to identify who they are or what the purpose of their visit was. At the center, when they answer the phone, they just answer it Center for Families and Youth. They're trained not to take paperwork into the field, so if they were mugged and someone took their briefcase, they would not have access to client information. And discussing clients out in the community is strictly prohibited. And then the clients must also sign confidentiality agreements and state that they understand that their information is being kept confidential. So the impact of the media, she said it's both helpful and harmful. It's helpful because it's helping to get the word out of the different agencies in existence and also of the services that they offer. She said it's harmful, though, because of the unintended consequences of technology, such as some of the problems that the children are experiencing due to social network sites like Facebook. There's, of course, online predators that the kids are dealing with, and then it's also really difficult for the parents to monitor their children's internet activity, and they're just constantly, possibly being exposed to dangerous situations and people through the media and the internet. Rosie's greatest accomplishment, she said, was being able to see her center survive in the declining economy and still be able to offer services to the families with such limited funding. She is very happy in being able to help her staff see that spending time with children doesn't require a lot of money, and that teaching the families to be able to do that really brings the families together closer, and it's just a matter of time and connecting versus how much money the families have. She enjoys empowering people and teaching them how to care for themselves, and she says that it's just really rewarding to see the families improve and succeed, to avoid out-of-home placement, and she's happy that the agency still exists.